Have you ever heard of a condition called preeclampsia? What is preeclampsia? So preeclampsia is a condition that occurs in pregnant women above the gestation age of 20 weeks. The cause is not well understood, but it's characterized by an elevated blood pressure, usually of above 140 over 90. Then you also have protein in urine. So we have a severe form of preeclampsia, which is called severe preeclampsia. And this one is characterized by an elevated blood pressure of above 160 over 110. Then you also have protein in urine. And when you do urinalysis, you find that the protein is more than 3+. So what happens? How does preeclampsia come about? So it is said that it's caused by an abnormally formed placenta. So before a woman gets pregnant, the uterus has blood supply. The lining of the uterus has blood supply. It comes from spiral arteries. So they're called spiral arteries because of their shape. They're shaped like a coil. When you get pregnant, the cells of the placenta are supposed to invade the lining of the uterus. And when this happens, those spiral arteries are supposed to become bigger to allow more blood to flow to the placenta so that there's that exchange of oxygen and nutrients. And this oxygen and nutrients goes to the fetus. But in preeclampsia, this does not happen. So the spiral arteries in preeclampsia remain narrow. So the placenta does not receive enough blood from the mother for that exchange to occur, meaning that the fetus will not receive enough nutrients and enough oxygen. So this may lead to growth restriction. It can also lead to fetal death. Yeah, unfortunately, that's what happened. So if the placenta, in this case where the placenta is not receiving enough blood, it starts producing some chemicals. So these chemicals go into the circulation of the mother. And these chemicals cause damage to the blood vessels. Now it doesn't even choose which blood vessels get damaged. It can be any blood vessels. So you find that the blood vessels, they even start leaking fluid into the surrounding area. So you find that women who have preeclampsia will present with edema. They'll appear swollen. Not to say that a woman who's pregnant and has some swelling has preeclampsia. They have to be evaluated. So yeah, we've noticed that many pregnant women actually have edema. But in preeclampsia, there's that elevated blood pressure. Then you have protein in urine. Then you have the edema also coming about. So in preeclampsia, there is also damage to the kidneys. There is kidney injury, which leads to the seeping of protein in the kidneys. Ideally, you shouldn't be seeping protein in your kidneys because proteins are big molecules that are not supposed to seep through the kidneys. So yeah, then it can also cause, it can injure your liver. It can cause damage to your brain. Now, if your blood pressures are high enough, they can even cause a hemorrhagic stroke. So your blood vessel just ruptures in your brain. That's how dangerous preeclampsia can be. And because you have this fluid seeping through your blood vessels, this seeping can also happen in the brain. And then you have the edema of the brain, which we call cerebral edema. Or if it happens in the lungs, you may present with what we call pulmonary edema. So you can see that preeclampsia affects so many organs. I'll make another video to talk about the complications of preeclampsia. So what are some of the risk factors of preeclampsia? So history of preeclampsia. If you've had preeclampsia before in previous pregnancies, you have about 25% chance of having preeclampsia in your next pregnancies. So it's not 100%, but yeah, 25%. Then if you are pregnant with twins, triplets, you have an increased risk of preeclampsia. If you are elderly, I don't even know why you call it elderly, but anyway, if you're like above the age of 35, you have an increased risk. If you are also a teenager, like extremes of age predispose you to preeclampsia. If you have chronic conditions that usually affect your blood vessels, things like hypertension, diabetes, if you're obese, you are at risk of preeclampsia. If your family has history of preeclampsia, you may have a risk of getting preeclampsia yourself. Yeah, so I hope that wasn't too confusing, but this was part 1 of preeclampsia. Bye.